Hello, and welcome to the Pharmacy Times News Network. I'm Nicole Grisano and your host for our Pharmacy Week in Review. With nearly any condition, starting treatment as early as possible is linked to optimal patient outcomes. A new study found that many patients with type 2 diabetes delay starting insulin therapy, according to a report in the American Journal of Pharmacy Benefits. The study found that as many as 3 in 10 patients with type 2 diabetes who require insulin therapy do not start treatment when their providers advise them to. These patients were found to delay insulin therapy for an average of 2 years, which may threaten overall health and increase the risk of diabetes-related complications. Medication and lifestyle changes are crucial for managing diabetes symptoms and preventing adverse health events, including heart disease, stroke, and amputations. In a report published in the CDC's Morbidity and Mortality Weekly Report, researchers analyzed insurance claims data to determine retention in medical care among children diagnosed with HIV, according to a report on PharmacyTimes.com. According to the report, current guidelines for treating children with HIV recommend medical visits every 3 to 4 months for the first 2 years after care initiation. The researchers used a 36-month study period that extended from the date of the first insurance claim that included the diagnostic billing code for HIV or AIDS. Cohorts included 163 children from the Medicaid database and 129 children from the commercial claims database. Retention in care was defined as at least 1 medical visit in each 6-month period during months 0 to 24, with a minimum of 60 days from the first medical visit in the prior 6-month period to the last medical visit in the subsequent 6-month period. Overall, the researchers estimated that among children diagnosed with HIV aged 13 years and older, 60% of the children insured through Medicare and 69% of the children who were insured through commercial insurance companies were retained in medical care. These proportions were similar to those demonstrated in analyses of insurance claims data for adults with HIV infection. The results of the 2017 Pharmacy Social Media Survey indicate that a majority of Americans want to interact with their pharmacists on social media, Specialty Pharmacy Times reported. An overwhelming 78% of respondents said that they would follow their pharmacist on social media, with nearly 50% already following them, according to the survey. Another 42% of respondents said that they wished their pharmacist had a more active social media presence. The respondents felt that through interacting on social media, they could receive promotions, notification of new services, healthcare news, tips about health and wellness, and vaccination reminders. Nearly all respondents said that they would take advice from pharmacists about health education, and 54% would use a recommended product, underscoring the growth and importance of these providers. Pharmacists may get more patient questions about medication safety after a video aired on the World Health Organization's YouTube page. The video, called Medication Without Harm, discusses how both patients and healthcare professionals play a role in ensuring medication safety. The video is part of a campaign by the World Health Organization, or WHO, to reduce medication-related harm by improving practices and reducing medication errors. For more information, visit the website below. For more great coverage and practical information for today's pharmacist, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. Thanks for watching our Pharmacy Week in Review. I'm Nicole Grisano at the Pharmacy Times News Network.